Anyway, welcome everybody. Thank you very much for your time. And I'm Isabella Natrin, so I'm the CEO at the association, and I'd like to introduce Ines Kerr, who is our Director of Business and Membership, everything membership. What are you, the director of? I don't know. We keep adding titles for him because he's so
business development, growth, and the
development.
member experience.
Exactly. And Jo Fleming here is with us this evening. Jo is a health coach too, and she's a great park runner and has been involved in park run for a long time. And it has helped us put together the pack for the park run event on the 18th of March. So without further ado, I will share screen and we'll start a little. Oh, could you enable me to share, someone please?
Yeah. Sorry. There you go. Should be okay now.
Okay. Right, can you all see my screen? Yeah?
Yeah, we're seeing that.
Lovely, okay.
No, I've got this one out ahead.
Okay. Right then, here we go. So welcome to Find Your Healthy. So what is Find Your Healthy Week, the 16th to the 23rd of March? So I just wanted to remind you that on the 16th of March, the association will be 5 years old. And we decided this year to celebrate our 5th anniversary by actually launching this week, which we hope very much will become an annual week where everybody in the health space and indeed the employment sector and insurance sector will eventually want to participate. So we're starting it off with our own health coaches, and we've got quite a few collaborators now across the health space from different health oriented organisations and individuals like doctors and physiotherapists and other grand folk who are going to be participating too. So as you can see, it's a focused, collaborative public health awareness and activity campaign. We want to use our collective voice as individuals and families, communities, people in the health space, businesses and employers to promote the impact of self-determined individual lifestyle and behaviour changes to improve our health outcomes. So, Jo, would you like to maybe just go through what the key messages are for the campaign?
Yeah, sure. So, I mean, as health and wellbeing coaches, health coaches, we all know what a difference it can make to our health and wellbeing when we make certain lifestyle choices. Lifestyle choices can support or undermine our health and well-being, and sometimes when you get patients or the public who you have a particular health goal, it can feel like it's a long way off, and it's important to make people realize that small changes, that small daily habits can make a difference to our health and well-being. So those small steps can make those big wins. So these are some of the key messages that we want to portray, that what will we and what will us as everyone as individuals, what can we do to find you're healthy?
Thanks, Jo. And here's why, Ines, why should they participate? Why should everyone really have a go at this?
Well, that one of our key focuses is to support health coaches and to raise public awareness of health coaching and the benefits that it can bring. So besides these 3 specific objectives, which we'll go to in a second, what we hope is that you will see this as an opportunity to promote yourselves within your local communities by driving engagement, and that further to that, you will use the opportunity to support your colleagues and support health coaches more broadly, and finally that you may see the opportunity to give something back. So whether that's to your clients or whether it is through participating in the park run or park walk. We'll cover up the opportunity you have to actually become a volunteer at park walk. So specifically, this is an opportunity to introduce yourself in person in your local community, and we're going to go through some resources later that have been put together with you in mind and with your target customer base in mind. As we've said, to help to raise public awareness for the role of health coaches and the benefits of health coaching, and helping to make people aware of the reasons why they would benefit from speaking to someone like you. Explaining the benefits of lifestyle change for health creation, as Joe was just talking about, and obviously the whole theme, find your healthy, and that's different things to different people. And again, as we walk you through the resources in the really well put together website, you'll see that there is a broad range of resources that you can use, but also that you can present to your clients. So that's going to increase your engagement with them and give them more value. And, you know, in the same vein, that's going to help you to promote your professional services. We want you to engage, you know, specifically through the park run events with local runners and walkers, which is a very broad section of society, but also use all of the resources to engage, you know, further with your clients, or re-engage with people that you haven't spoken to for a while. And then finally, as we said, hopefully you'll see the opportunity to give something back by participating and supporting Park Run well after the event around the Find Your Healthy campaign.
Thanks, Ines. Thank you. Okay, so there are 6 elements of the Find Your Healthy campaign. So from the 16th of March, we want to encourage you to indulge yourself in social sharing with the hashtag Find Your Healthy. As Ines was just saying, just now we'll take you through the social media assets that are on the website that we've created. And these are a whole bunch of customizable templates that you can for copy, so that you don't have to rack your brains about what shall I write in this. You can fiddle around with the templates. They're Word templates, so you can make them what you will. Then you just cut and paste and put them into your own social posts. And Find Your Healthy graphics as well, which I hope you'll enjoy. We think they're great fun. Secondly, there's a public resource directory, really. So within that, when we'll be going through all of this, all I want to do at the moment is to just give you the idea of what's available, and we'll take you step by step through the resources just now. So we've started that with what is health coaching, how can it help you? So obviously that's a plug for the association and for our qualified members. And then we've resources for all of these categories, and you'll see when you have a look and take your time to go through them that there are links to trusted resources for each of these elements. So eating, moving, sleeping, resting, distressing, community and connection, minding your mind, which is the mental health aspect, general and chronic health conditions, emerging health disciplines, which are things like lifestyle medicine, functional medicine, integrative healthcare, and sustainability and the health ecosystem. So that's the part about being healthy, understanding where we fit within our wider ecosystem, you know, of the planet. So the next
conversations to find your healthy. So this is a really simple idea, but one that, you know, we know that everybody engages with video, and it can be a very compelling format. So what we'll be doing as the association is we'll be inviting supporters to talk about how they find their healthy and what that means to them, in the form of whatever you want to call it, vox pops or video chat or podcast, short format videos just on mobile phones. And they'll be made available to you so that you can share those on your own socials to help to drive engagement and spike interest. But also would encourage you then to make your own short video and talk, you know, with your client base or your target client base in mind, thinking about what Find Your Healthy means to you, what your clients, how they might benefit from it, and you know what they give them some ideas about what they could do in order to find their healthy. And I'd like you to think about your UKIHCA account, and if you haven't looked on there recently, just to remind you that you know there is the opportunity for you to share socials there, link your socials, share videos. There's even the events calendar, so you could put the Find Your Healthy week on there as an event. And these are all tools by which you know you can increase the chances of people finding you. So yeah, great opportunity for increasing engagement and having a bit of fun with it.
Yeah, and just to say that Innes has created a little video of his own, which is nice, and I did one at the weekend to share my Find Your Healthy. So we're just having those put together and we'll be releasing them soon, but please do have a go. It's really good fun, you know, so we don't need any you know, it's just spontaneous. What do you do to find your healthy? Let's all share. That's the whole point of that. So Jo, would you like to tell people about Parkrun?
Yeah, so one of the highlights of the Find Your Healthy campaign is our UKIHCA Live at Parkrun event. So, I mean, for anyone that isn't familiar with Parkrun, I'm sure most of you are, but for those of you that aren't, it happens every Saturday morning at 9 o'clock. And there's hundreds of Parkrun locations across the country. So if you're wanting to know where there's one near to you, if you go onto the Parkrun website, there's a map of the UK on there. You can zoom in on where you live and guaranteed there'll be one, you know, pretty close to you. So first of all, find out where your nearest Parkrun is. Parkrun it's open to everyone. So you've got people right at the front that are running as fast as they can, right through to the tail walker and the walkers who are doing it in around an hour plus. So it really is for everyone. So the idea is that on the 18th of March, as UKIHCA members, we will go to Parkrun, and we've set up kind of a guide to participating. So on the website, there's all the information you need about what to do to be at this UKIHCA live event at Parkrun. So there's a guide on there about how to find where your Parkrun is and things like that. And then there's an email template to the Parkrun director. So once you've decided which Parkrun is your local one and which one will be most beneficial to go to, we've got an email template on the website that you can email to the run director, the event director at Parkrun. Now you'll find the email address on your local Parkrun website. It's the same one that you would email if you wanted to volunteer. And we've got an email template there that you can copy and paste and send to them, and just insert your details as you like, to tell them all about it and that you'd like to come along. So I've done this already with my local Parkrun Leamington. They came back, they were very happy about it. They wanted to know a bit more about whether it was an NHS-based event and things like that. I assured them that it wasn't NHS, it was UKIHCA, but we'd been in discussions with Parkrun and they were happy to support it, etc. So they were very pleased. And I've also volunteered as the park walker that day, so that if that's something you'd like to do. The park walker is different to the tail walker. So the tail walker goes right at the back and kind of makes sure that nobody comes last. The park walker is kind of the in-between person between the runners and the tail walkers. So you kind of mingle in. So it's a really good place to be at Parkrun, a volunteer role for if you want to interact with a lot of different people. So you'll find all that, the email template and how to do that on the website. Now the idea is that we will have these lanyards and laminates. So we will, if you're volunteering, you'll be given the park walker, the Parkrun bib, but then to identify ourselves and to have the QR code and all the information about Find Your Healthy campaign, you can get a lanyard and laminates from Innes, I believe. There's instructions on how you can do that, and you can wear that around your neck, and there'll be a QR code on there that people that you're talking to might want to just get that on their phone and get more information. As you're going around park run, you know, talk to people, tell them about your health coaching, speak to them about how they find they're healthy, promote the campaign. And as you do so, if you can, use your smartphone to do videos, images, and the idea being that we can use all of that for social media sharing and using the hashtag #FindYourHealthy on the day, and we can get a good bit of social media community going on around that, across all the parkrun events across the country. I mean, parkrun has become a bit of a global public health initiative, so it's an absolutely fantastic place for us to highlight our Find Your Healthy campaign for sure.
Yeah, thank you, Jo. And for anyone that's listening, or as I said, we'll be sending this recording out to all the members. So we have obviously got members in America and in Australia and in South Africa, and all have got park runs. So if you've got a local park run, please do join it. Okay, Ines, over to you.
I was just going to close on that last point by saying, incidentally, once you see these wonderful lanyards, I'm sure you'll feel compelled to wear them, not only at the parkrun on Saturday, but, you know, maybe around the house, but certainly as you go shopping or out to the local cafe, and, you know, just get the word out there. So be creative with how you might utilize that. So this initiative here with Sport England and the Office for Health and Improvement and Disparities is sponsored by the National Lottery, as I say, in conjunction with Sport England. And the person that's presenting this to our members, that's you. Some of you will know Dr. Dimple Devidas, who I wasn't here, but predates me in relation to our online conference. I believe Dimple participated in that. But this initiative, which is essentially, it's designed to educate health professionals about the benefits of physical activity for the prevention and management for long-term conditions. Now that sounds a very dry subject matter, maybe less dry if you're into personal training or physical activity instruction in some way or not. However, we're assured that the quality is very high. Secondly, that Dr. Dimple says that she will make this amusing and engaging, and there's some very significant resources that will be made available to you. So just to be clear, because as we know, health coaching is not in the medical sector. However, because this program has met its targets around professional engagement, they're able to extend this out. So we're going to get the benefit of that. So there's 2 dates to look out for. You'll see further communications. There's webinars on Friday the 16th of March and Tuesday the 21st of March, where, as I say, Dr. Dimple Devidas will be taking us through all of that.
Thanks, Ines.
And then, if that weren't enough, Stand for Health, which is an initiative that's being driven by BSLM, which is Society for Lifestyle Medicine. Many of you will be aware of. And this is an initiative. So 2 elements to this is, if you're not into physical activity, then you might find that the initiative around meditation is more your thing. But if you were to go to the BSLM website and just search for the Stand for Health, you'll see there's some very clear instructions on how you can engage. But this is, again, promoting the benefits of either meditation or physical activity. Again, it's through social media, so it's about recording your own, maybe not the meditation, that might not be too interesting for people to observe, but certainly the 2.5 minute movement routine. And I can assure you, it's not particularly complicated. I'm not a great one for choreographed classes, but even I can do this. So it's some very simple movements that BSLM have put together, and very much like our healthy conversations for Find Your Healthy, this is about, you know, promoting physical activity and growing engagement and getting people gaining awareness for the campaign overall. So again, it's another arm to Find Your Healthy. It's about physical activity, and it's something that you can have fun with, but also it's another tool to use for you to engage with your clients, but with your target audience as well.
Thanks, Ines. Okay, so there is the website at the bottom, the link to the website. So I'm going to stop screen sharing with this. So guys, this is the page that you come to. If you go on to our homepage, there's a space on there where you click on the link and it will take you to this page. So if you could just scroll up slowly, Ines, please. Okay, just keep scrolling. This is just some blurb. There's a little video there that we won't watch, but do click on it. It's myself and Joe just explaining what the event is about and why you should participate. These two next windows here, on the left-hand side is the directory, on the right-hand side is the information pack and all of the asset pack. And then towards the bottom of the screen are the different organisations who are, and we're adding to these every day as they say, yes, we'll be part of it. What we're going to concentrate on tonight, though, are these two little windows in the middle. So Ines, if you could click on the gold one first, and we'll take people through the collaborators pack. Okay, so when you click through there, you'll see two more windows. On the left-hand side is your coaches information pack. So if you could click on there. And you'll see then there's a whole load of different guides and things that we've put up for you. So the first one, thanks, is that. Okay, now this is quite comprehensive. It tells you exactly all the background about the campaign. It tells you what to do, how to participate. It sends you to the social media asset pack. It sends you to the directory, and it sends you to this webinar if you would have picked it up beforehand. Now, so Dennis, if you could just slowly go through that screen. So as you can see, it's got background there, why you should participate, what the key messages are, which channels of communication you might want to use, where we've got social media asset pack. We'll look at that separately in a moment, but you can link to there through the blue links. You can link to the directory, and obviously you're not linking to this webinar because you're in it. Then the various elements, again, as I said, we've gone through this. This is just really for those that haven't attended this webinar and want to just read it for themselves. But you can see the whole this whole pack will help you work your way through all the various elements of the campaign. Okay, so the next one then is the parkrun guide. So this is what Joe has been talking about. What is parkrun? How do you join? What to do? These the parkrun have partnered with us. They have said that parkrun directors will expect to hear from you if you want to participate. There is a template which I was going to show you actually, but since there's something gone slightly awry, I just wanted to show you the template for customizing. So you just put your name, and we've got fields in there that it's just a Word document. So you click on the template, download it, put your own information in and send it off to the parkrun. There's a link within this guide for parkrun to find your local parkrun. So we've linked to the parkrun website.
So this is the template letter to the organisers.
Yeah, this is the template letter here. And then Joe has, and this is available separately, this template letter. So this is just to show you what's in the template. And then Ines, if you could scroll up a little bit more. That last part now is what to do for participating. So you can see, arrive early, decide what you want to do, put your lanyard on and talk to people, and really just enjoy it and engage and take lots of photographs and share them on social with the hashtag Find Your Healthy. Okay, I think we can come out of that one now.
Just before we do then, so in here is there's a link here to a form that you'll use for registering for the lanyard that we'll send you. And I think you might get you get a link on email as well, but you can, in the meanwhile, you can go down here, you can go through this route. So via the website, through these resources, click on there and you'll get into the form to register, and we'll send out the lanyard kit for you.
Lovely. Okay.
So I think this is what you just...
Yeah, so this is the link to the social. Within that document you've just seen, there is a link to this social media assets pack. So as we can see at the top, there's the Find Your, on the top left-hand side, the Find Your Healthy Week logo, which you can download, and you can use that as a graphic in your socials. But if you would like to use any of the elements of the Find Your Healthy resource pack, which we'll show you in a minute, the public health resource pack, we've got community and connection, minding your mind, eating to find your healthy, moving, sleeping, resting and de-stressing to find your healthy. And those graphics are in the Instagram size and also the Facebook size. And the idea is that you use one of those graphics if you want to. Of course, you can always make your own, but these are easy to use. You right click, you'll download it and then open it up in your on your computers as a graphic, and then upload that to your social media accounts. And then if you just go, that's it, where we've got click here for a customizable Word document. Here are the whole of the different templates. So here you can see one for healthcare professionals and practitioners. So they're all very similar, slight nuances in the way it's expressed. So we've tried to make them relevant to a whole range of different collaborators. So, you know, you could say as a doctor, as a dentist, a physio, a health coach. I've joined the UKIHCA Health Coaching Association in the Find Your Healthy campaign because I'm committed to helping and supporting you. And then where the bullet points are below, you can write some suggestions in. So, whoops, what's happened? We've lost the screen share here.
Okay, I think that might, am I still here?
You're still here? Yeah.
Yeah, sorry, I think my connection just unfortunately dropped out there. Hang on one second. Are you back? That's
it. Yeah, there we're back. So you'll need to, obviously it would take all night for me to go through all of this word for word, but trust me, there are templates here for all kinds of, so if you're part of a community, if you're an employer, if you're an insurance company, if you are a practitioner, if you're a health agency, a PCN, for instance, or a private lifestyle medicine practice, there is something in here that you can use. You don't have to use these templates, but it makes it easy if you want to. So yeah, those are those templates. So if you can come back out of that now, and we'll go back to that's the one, yeah, the blue window.
So this is just remind people this is on the home page now and coming into the public resources.
Okay, so we've started off. So this is a directory that you can link people to, link your social media posts to if you want to tell people where they can get resources to find they're healthy. We've started it off with a plug for coaches and health coaching, so people begin to understand, you know, what is health coaching, how can it help them. You can link people to the guide for health coaching there in green if you want to. The directory will be updated throughout the campaign and will be a permanent feature going forward on the UKIHCA website. And as you can see, there are a whole bunch of windows there that represent different aspects of healthy lifestyle. So if we click on moving, for instance, we've got Deepak Chopra with Why Move Your Body. We've got Park Run itself. We've got Daryl Edwards, who again helped us with our conference last year. We've got Couch to 5K, Walk Active, the Real Food Runners, the 5K Your Way, which Joe is involved in those events. So if we could go to, say, Minding Your Mind. We have Happy Full, which is a magazine which you can subscribe to online. The Samaritans, obviously, Mind, Young Minds, Mental Health Foundation. Food for the Brain is a new charity, and we've chosen to support them as much as we can. Let's try chronic health conditions then. Okay, so we have links to cancer support, cardiovascular and heart health. We're waiting for feedback on the best sources for that. We've got obesity, chronic pain support. Deepak Ravindran is absolutely brilliant, and his podcasts and his YouTube channels are fantastic, thoroughly recommended. And then the Bath Centre for Pain Services. And so it goes on. So our the whole point of this website really is for people to be able to find they're healthy. So the idea is, folks, if you do you want to just come out of screen share for a moment on this? So the idea here is, I don't know if you can see my little notebook here. So this is, let's say this is an A5 lanyard. Inside there will be the Find Your Healthy laminated logo with a QR code. The QR code will take you to the website, and you can say to people, if you have a look on the website, you'll find a directory of resources where you can find your healthy. So they can have ideas of, you know, whatever appeals to them, they can have a look through it. You can, you can take yourself through it, familiarize yourself with the website, and you can talk to people about it when you're with them at, hopefully at the event on the 18th of March. Now, the whole point of this event is for everybody to collaborate and participate and make as much noise as possible on social media. So whether it's sharing those resources, sharing the graphics, making your own messages up, you know, everyone can think of 5 ways that people might find they're healthy through what they eat. It's not being directive or giving advice. It's just saying, you know, processed food, you might want to rethink that. Hydrate, you might want to think about that. You know, those kinds of general pointers towards what people can do to find their health in any of those areas. So this is an opportunity, as Denise was saying, for you to actually have resources to be all talking together to your public in the knowledge that we're being supported by the Royal College of GPs Active Practice is supporting it. ION, which is Institute of Optimum Nutrition, Food for the Brain. BANT will be supporting it. They're on leave. Everyone seems to be on leave at BANT at the moment, so waiting to hear back from them. So that's the whole point. It's the point to really say, how can we as a health sector use each other's voices and collaborate and make a lot of noise to help the general public find they're healthy. So that is, in a nutshell, what it's all about. So please do, unmute and ask questions, and we'll do our best to help guide you through it.
Can I ask a question?
Yeah, of course.
It looks fantastic. I can appreciate there's a lot of work gone into that. So it's really, really exciting. I just wondered, is there, the menopause has got a lot of sort of celebrities behind it. Is there any chance we could get a celebrity to be behind the whole health coach movement? And I think with the, the whole preventative approach to medicine now, Professor Chris Whitty speaking about it at the Select Committee last week, there is this movement towards prevention in the NHS. So it would be amazing if we could get sort of champions that are celebrities that could go and talk about this. Is there anybody that you know of that could kind of just raise the profile?
There's obviously, Rangan Chatterjee is we're still waiting to hear from him. It's very difficult to get into their diaries. Even Rangan is hard to reach. But Oyan Panja, who has a podcast of his own, who's just written The Health Fix, he's a GP in the NHS. When he comes back from his family trip to the States, he will lend his voice. Going forward, this is not just the first year. We aim to do this every year, and we feel we can really grow the movement. So I think we're quite modest in the way that we're starting it. If any of you or anybody listening to this recording subsequently have any contacts that you would like to either make yourself or put us in touch with, absolutely yes. We have tried to stalk a few, Zan, on Instagram, but they haven't responded. we will keep trying, and we will get, you will get through, but you can imagine that it's a huge job, and you have to be very, very persistent, and they're very well protected, some of them, so that otherwise they would be completely inundated. But yes, please do.
I've got one or two people in mind that I kind of stalk on Instagram, and I've had a few conversations with, so I'll see what I can do. I'll let you know, Isabel.
So just if I could just amplify that then. So as Isabella said, this is year one, and we intend this to be an ongoing thing, and it will grow and gain momentum. And if any of you have ever been involved in anything like this before, you'll know that from small beginnings and acorns and oak trees and all of that. But my own previous experience was with what was called the Fitness Industry Association, which is now the UK Active, and we started National Fitness Day, which started very slowly, and by year 3, Sir Steve Redgrave was fronting that, and then various other celebrities, because they wanted to be involved. So by doing your little Find Your Healthy conversations and posting on every social platform, LinkedIn, Insta, Pinterest, all of those, that's how the awareness grows, and people pick up on this stuff, and then they want to become involved. So the more you do, the more the awareness grows, and the more chance of some of these really viable celebrities picking up on it.
Yeah, and I think they will, because we have already had messages back with apologies to say that there is no capacity for them to do that this year, but next year they definitely will. And we know that next year the Australian Health Coaching Association, Australia and New Zealand, will be participating, but they don't have capacity this year because it clashes with all kinds of things that that are going on for them. There is absolutely no reason why this can't be an international campaign, our ambition is to actually have it registered as International Find Your Healthy Day. But we need some evidence, we need some track record, and we need you guys to be there and fly the flag and make your lanyards and do all the stuff that that needs to be done, and especially sharing on social media with hashtag Find Your Healthy. As I say, make a little 2-minute video on your iPhone. I did one on Sunday morning in my kitchen. I might make another one because I was inspired to my former life of doing cookery demonstrations, and I had a small cookery school, so I might demonstrate a Find Your Healthy recipe to add to the, I might win an award for it, I don't know, but I'd love to see your your videos and whatever it is that you do. It might be breathing techniques, that would be nice, wouldn't it? Anybody that's into breath work, or a yoga pose. I've been watching on I think it's probably Instagram, the legs up the wall jobby. Oh my God, what doesn't that do for you? Legs up the wall, so that would be a good one to do. And it's not hard, is it, just to demonstrate? It's a bit of fun, and it's helping people find they're healthy as well. So yeah, please do join in and make as much noise as you want, and post as often as you want, because that's what we're a small team, so we rely on you guys to really participate in this. And it's your opportunity really of actually really being involved, because we did the conference last year and that was lovely, and lots of you came and attended and had recordings, and it was a really fun day. But this is really for the public. How much longer are we going to sit and not do anything collectively to help people with preventive healthcare? If it has to be from the ground up, it really does. There's nothing to stop us from putting out these messages throughout the year. It doesn't have to be just for that day, but from this day we hope we will get a permanent record. And as I said, we're going to make space on the website for it, so that that resource for the public is there all the time, which will help you when you're pitching yourselves to your client base, to say, this is part of what we do. Here are the kinds of resources that we have collected for you, and those things will be we'll get better and better at it. This is our first year, and so come on, let's make it the first year of very many, and help it grow.
Could I maybe say something?
Yeah.
Because your word like breathing and breathing technique also is like there is Stuart Sandeman from BreathePod. I don't know if anybody knows him. He wrote this book this year, Breathe In, Breathe Out.
Ah, yes.
And he started off just before lockdown, or basically in lockdown, every morning at 7 o'clock or 7:30 it was, doing a breathing session on Instagram for 30 minutes for free, every single day. And my daughter and me, we were laying in bed and did his breathing techniques, and it was just mind-blowing. And he had then about 200 or 300 people every morning, and now he has 400, 500, and he went on Instagram from 17,000, he has now 60,000 followers, and he does also BBC radio decompression for the mental health as well. But he starts again on the 6th of March, a spring clean, with breathing, visualization and manifestation. I can really just recommend him to everyone. And I think he would also recommend the week and would announce it as well for us.
Okay, well, are you in touch with him, Birgit?
Yes, I am, because I'm posting some of his, and then he posts it back. And yes, I will mention it to him.
Oh, please do. Send him to the website, and we'd be very pleased to include him as a collaborator on those pages, and put his logo in at the bottom of the front page. But I've just made, so it's Stuart Sandeman, Breathe In, Breathe Out. So we'll have a look at that, and we'll add it to the resources for the rest and de-stress section. But if anybody else has got, they've got to be trusted resources, so they have to be really acknowledged experts. But we have to be careful, obviously, as an association, who we recommend and where we recommend. But anybody who is published and is, you know, and has got a background that is has sufficient gravitas really for us to recommend, that would be wonderful. Thank you for that.
Okay.
Anybody else? Do feel free to write in. Who should they write into? Would it be info@Innis with any suggestions?
Yeah, info@'s probably the best one. info@UKIHCA.com.
Anybody else for any more?
Just if you do that, please just use the message title, Find Your Healthy.
Okay, no more questions?
There's nothing in chat at the minute, so everyone's gone quiet.
Okay, I expect they're all in awe and stunned into silence with the wonderful resources that we've created. Well, look, guys, please use them. Please participate. Let us know how you're getting on. If you want help, if you're struggling with understanding the destructions, as it were, then please let us know, because we want you to participate. And as much as anything else, we want this to be an opportunity for you to have an excuse to be visible in your own communities, because that's where health starts, isn't it? You know, health doesn't start in the doctor's surgery or the health coach's clinic or on the other end of a Zoom call. It starts out there in the community with your local residents and your people. So, you know, this is your opportunity to get to know them. Take some business cards, take some of your own literature, handouts, if you want to. No problem at all with that. I think Joe, in some areas you can ask to make an announcement through the speakers or whatever. So.
Yeah, you can do. Yeah, some of the park runs, I think some, they're not necessarily happy with you handing out things, so you might want to check with that park run. But yeah, if you want to do a little announcement in the runners briefing at the beginning, then you can take the microphone or whatever and just say that you're there, and people can come and chat with you about things.
So I think just to remind people then that in that collaborators resources then is that template letter, which you've written, Joe, haven't you? So it resonates with the organisers. So send it to your local park run organiser, and then start a conversation with them, and you'll get more out of it.
That's it. Yeah.
Okay, well, if there are no more questions, shall we say good night? We're just on 9 o'clock, which is brilliant.
Pim's o'clock.
Pim's o'clock, yeah. Okay, all right then, my lovely colleagues. I'll say thank you once again for joining us this evening, and wish you lots of luck, and, you know, go find your healthy.